Welcome to a new edition of The New Abnormal. My name's Courtney Walker. I'm a managing director at Good Fuse. I'm here joined with my good friend, Rich Masters, who I've known for a very long time. He is boy, how do I describe Rich? He's a New Orleans Saint enthusiast. He has spent decades as a political consultant. And finally, and most notably, he is the executive director at Bio.
Hey, glad to be here.
All right, so let's start first. Rich, when I think of bio, and I've been in healthcare for a long time, but when I think of bio as like the baby sister of pharma, just another large trade organization. I think you're going to tell me that that's not true, and I'm woefully misinformed. But what should people know about bio that they may not know?
Well, and there's a lot of interesting things, and it is significantly different. I do think oftentimes bio gets kind of lumped in with its bigger and more well-funded cousin pharma, because on some things we share a lot of policy kind of similarities for sure. But bio is a completely different organization. For instance, pharma has 32, 33 companies. That's their entire membership. We have almost 1,000. And of those 90% of our companies are pre-revenue. They're all being funded by venture capitalists and by life science investors, and so a lot of them aren't even to a product yet. I mean, they're just in either clinical trial phase 1, phase 2, usually before they kind of expand and grow. So they're very small. The other thing that is different is we actually represent kind of the entire biotech sector, not just biopharmaceuticals. I mean, clearly, biopharma and life sciences are really, really important. They're the majority of the companies because they're the majority of biotech companies in general. But we also are representing some unbelievable life science companies that are working on unique biotechnology to help feed the world. I mean, we're talking about genetically modified organisms and cool companies that are being able to have GMO, salmon, for instance, which is really extremely interesting. And then we also have a number of our companies are working on essentially trying to save the planet, biotechnology ways to save the planet. We have one company, for instance, everyone hates the little plastic bottles you get in hotel rooms. Well, they're coming up with a biotech solution to be able to, wash the hands and the bottle disappears in a safer way. So we like to say we're saving the planet, feeding the world, and of course, keeping the world healthy.
I did not think of you that way. I think of you, the only part of the elephant I touch is really kind of the healthcare part of it. But speaking of the planet and the world, the sun that revolves around my Earth right now is the election. Ooh. And I'm curious, we don't know who won, but what do you think? What is Bio's position on the election? I mean, what do you think is going to come out of this?
So biotechnology, we know one thing. I mean, one thing in the last several years that Democrats and Republicans seem to agree on is that biopharmaceutical companies are awful, they're greedy, they're corrupt across the board. Right. And so bio in particular has got to do a much better job of telling its story. And that's exactly what we've set out to do. I've been at bio now about a year, and then change. And one of the things we really are doing is we're trying to set up a huge content engine, which will, fundamentally change the perception of the industry. So the election is going to be interesting because we know that we're going to be one of the first pieces of legislation up in the new Congress with the new administration. And drug pricing. And the one thing that I think everybody agrees on in the drug pricing thing is that patients pay too much at the counter. Now, the question is, how do you fix that? And Bio's position is that the way we're going to fix it And hopefully now that the election and the silly talk is done, because during the middle of election, it's let's crack down on the drug companies. Let's put price controls on them because it's a simple solution. It's a simple political solution, but there are consequences for that. And so one of the things that we're going to have to do to both the Biden administration as well as new members of Congress and others is we're going to have to do a much better job of explaining the cause and effect. And if you institute draconian price controls on the companies, it's not going to make drug companies go away. It's not going to make them change much of their behavior. What it is going to do is it is going to seriously hamper the ability of our small scientists, small company scientists, to be able to work on cures that are going to affect small patient populations. And that has impacts across the spectrum. And we know price controls will result in, at a minimum, 12 or 13 new medicines being developed to maybe 100 plus. The number is irrelevant. If you are sick and you're waiting for a cure and it's your medicine that doesn't get an investment, that's a problem.
Right. Well, Rich, as always, a very spirited discussion, my friend. And I really thank you for your time. Any questions or comments, please leave them, I would say, below. And thank you, Rich. Lots to come today and in the future. All right.
Thanks.
Thanks.